Hi there, I'm Mia Keys, a public health researcher, women's health champion, and author of the first comprehensive maternal health policy in all of congressional history, the Mamas Act. I'm also a mama. And in the last section, you just heard about the essentials of advocacy in supporting pregnancy and birthing. And so now we're going to talk about birth work and how you can use it to promote self-advocacy for birthing people. Feel free to share these tools with women and birthing people you know, as everyone needs it. So let's start with a framework for decision-making within birthing. The BRAIN acronym is a great place to start. When confronted with a major decision for your birthing experience, I want you to consider, is it B, beneficial for both you and your baby? What are the R, risks? Do they outweigh the benefits? What are the A, alternatives? Can we do something in place of this decision that would work better for you? What is your I, intuition, telling you? What is coming up for you naturally? And finally, is it best to do N, nothing? Sometimes inaction is just as important as action. So ask yourself, is it better to do nothing at all? When it comes to self-advocacy during pregnancy and childbirth, the birth plan is the embodiment of it. A birth plan is a written document that outlines the birthing person's desires for their labor and childbirth. It also functions as a communication tool for the care team. Labor and childbirth can be incredibly busy moments, and I can personally attest that having a birth plan can be grounding in that it allows the birthing person to communicate their desires without having to speak in the moment. While the day of labor itself may call for shifts from the birth plan, it is still effective because it gives the care team and the birthing person something to aspire to. The birthing plan can include desires for the environment, the use of interventions, delivery preferences, and preferences for the early postpartum period as well. While flexibility is key, early discussion with care providers can help in ensuring that communication and expectations are clear for the delivery date. Another mode of self-advocacy involves the acknowledgement that it takes a village. For this reason, women and birthing people must grow comfortable with calling in community. There are few things that people can do to make sure they're wrapped in community during this critical time. The first thing doesn't involve any direct action. Rather, it is about establishing capacity. What this means is deciding what one can realistically do without assistance. Now, the reason this is important is because once someone is clear on their own capacity, they become clear on when they've exhausted their efforts and their energy, or when something is asking too much of it. And under these circumstances, you would know when to ask for assistance. The second thing is of utmost importance. I want you to get used to asking for help. Now, this may be difficult for people who feel like they have to handle things on their own. I was certainly one of those people. And for some, it may mean learning to sit with the discomfort of asking or working through those feelings to reframe their relationship with assistance seeking.
Hello, I'm Dr. Tia Jackson-Bay, an obstetrician, gynecologist, and fertility specialist. We just gave you a rundown on the essentials of self-advocacy during pregnancy and childbirth. Part of that self-advocacy involves collaborating with all the people working hard to ensure that you and your baby remain safe and healthy. Let's talk about how you can engage with medical professionals and birth workers to collaborate towards your common goal of safe delivery. First, let's establish context. Many people give birth in a hospital setting, and so these tips keep that in mind. But these tips can also apply to other settings like freestanding birthing centers. In the hospital setting, childbirth takes place in the unit we call labor and delivery. This is where expectant mothers meet with healthcare professionals and birth workers, such as obstetricians, midwives, nurses, and doulas. This is also where a lot of important conversations are happening and important information is exchanged. There are some things a birthing person and their support system should keep in mind as they engage with medical professionals. From the moment of arrival, I encourage you to establish and maintain open communication with your care team. This looks like sharing preferences, concerns, and questions. Pregnancy can be a time of great anxiety and uncertainty, and it's okay to acknowledge that. Part of your team's job is to work with you to alleviate your stress. Another tip is to stay informed. A lot of information will come at you in different forms, so it's important to be knowledgeable. It makes it easier for you to participate in conversations about your care or the care of your loved one. When you know more about your options, you can participate in informed decision-making. Lastly, you want to trust your instincts. It's always better to be safe than sorry. Do not hesitate to communicate with the healthcare team if you feel that something is wrong or does not feel right to you. As mentioned previously, the birth plan is one tool for establishing productive communication early on in your birthing process. It allows your care team to be clear on what you want for your delivery and early postpartum experience. While it's a useful tool on its own, there are some things to consider as you communicate your desires for childbirth. Not only should you prepare a birth plan in advance, but you should be prepared for potential changes. What this means is having an ideal plan and also trying to anticipate which items could change. This helps with communication because it means that the conversation does not end once something looks different. It also means that your preferences can still be honored, even within the context of this change. Another thing to consider is that your care team extends beyond the hospital. Labor and delivery are unpredictable processes, and so you want to communicate your preferences with your support system early on. That way, if you are unable to speak up for any reason, the people in the room are still aware of what you want. We hope that you found this helpful. Thank you so much for participating in this advocacy training session.